Happy Wednesday, and happy beginning of November. Um, what we have just a couple things on our agenda. So our epidemiology team will be giving us a respiratory disease prevention update. Our friends over at Arizona Department of Health Services will be presenting on drinking water and getting tested for lead. And then our people over at FEP, and I know there's a new name and I cannot recall the name, will be doing a little presentation on getting schools PPE. Um, just a couple announcements. Again, we have our biweekly newsletter. If you want to subscribe, please do. And we also, if you are needing Narcan, please reach out to us that we can provide that for you all. So I'm gonna go ahead and turn it over. Eliana, oh yeah, I see. Okay.
I'm here. Good afternoon, everybody. Thank you, Christopher. It looks like we avoided tech issues today. Happy first day of November, like Christopher said. My name is Eliana. I'm an epidemiologist here at Pima County Health Department, and I will be helping the school update with some respiratory updates. Next slide, please. Starting with COVID-19, I have mentioned in this call the current metric that CDC is using to evaluate transmission levels in our community as the COVID-19 hospital admission levels. I have included in this slide what they currently are as of October 14th. We are seeing a slight increase in the number of cases as compared to previous weeks. However, I'll show in another slide that it's fairly slight. However, our department, emergency department visits are a little bit more steeply increased, as well as our hospitalizations. However, because the metric that is used by CDC to measure community levels of COVID-19 at this time is the number of hospitalizations per 100,000 in our community. And that number continues to be below 10 at 5.2 as per our last update. And it continues to show Pima County in the low category or the low metric for COVID-19 hospital admission levels. So the main recommendations have not changed over the past few months. We continue to recommend people in our community, especially in schools and other high-risk settings, or congregate settings, to continue to stay up to date with COVID-19 vaccines, maintain ventilation improvements. Isolation guidance for those affected by COVID-19 has not changed, as well as what to do if you're exposed to somebody with COVID-19. Next slide, please. As far as cases by week, we also have ADHS providing us some data. And like I was mentioning, I included this slide to show that this change in cases reported, laboratory confirmed COVID-19 cases reported, is slight from previous week. You can see there in the green curve. However, it's not as steep as the other metrics. Next slide, please. As far as influenza, we have just begun a new respiratory season. It began on October 1st, and we utilize what we call the MMWR week 40 as the beginning of a flu and RSV season. So all of our graphs from our last call were towards the end of the 2022-2023 season, whereas these ones are in the beginning of the next season. So far in Pima County for influenza cases, we're at 39. It's the blue curve on this graph here, and it's about 2 times higher compared to what the 5-year average is. However, it's still pretty low as compared to what the peaks are on the graph. We have seen a slight change. Oh, I'm getting a comment that the slides are not changing. Is there any tech issues, Chris?
I'm on the slide of the influenza.
Maybe
is
it's on the user end, this error.
is
I see influenza as well.
is anyone else on the call only not seeing influenza? Oh, okay. Let me unshare it and reshare it again.
Apologies, everybody. I could see the influenza slide, so I didn't realize that weren't changing for other people.
Is it changing now?
Mm, we are getting some people saying that they are seeing the influenza slide, but others that are saying no.
Here, let me go ahead and try resharing it again. Okay. Is everyone seeing the influenza slide now? Okay.
Yes, I think that fixed. Yes, now.
Okay. Thank you all so much. We do appreciate your patience.
Thank you, Christopher, for helping and for those who said something. Please go back one slide over if you can, Christopher, to the Pima. This is the Pima County COVID-19 cases by week. So for those who were not able to see, this is what the curve looks like. Green are current cases, and we're below what we saw for 3 years average, as I was mentioning, but slight increase, slight change as compared to the week prior. Move one forward, please. And then, as I was mentioning for influenza season, we're a little bit higher than the 5-year average, however low as compared to what the peaks we usually see. We have seen an increase from the prior week, and most of the people that are testing positive for influenza, 31% of those are actually in the age category of 0 to 4 years old, which is a little bit different from what we usually see, which flu tends to affect people over 18. Next slide, please. As far as RSV goes, once again, season began on October 1st. You can see the pink beginning of this curve here, and you can see that RSV is also a little bit increased as compared to the 5-year average. It is a increase that is slightly lower than what we saw for flu, however, still an increase. The majority of cases that are affected by RSV in Pima County are those who are 1 to 4 years old, which is typically what counts for the second most people that we see affected by RSV. Like I mentioned, as you can see across the board, both COVID-19, or all three of them, COVID-19, flu, and RSV, have seen an increase over the prior week and month. However, very slight above either 3-year or 5-year average. I'm sorry, some people are still not able to see the slides on the screen. I think they will be shared at the end of the call if they weren't previously. So I apologize for the technical difficulties. Next, please, Christopher. I wanted to include this slide because I know I just said that our respiratory season is just beginning and we're seeing increases in COVID-19 flu and RSV. So the most straightforward recommendation at this time continue to be safe and updated vaccines. COVID-19 got a new monovalent updated vaccine. And depending on if you're eligible or not, we also have some vaccines for RSV as well as flu. There's also effective treatments available for flu and COVID-19, as well as testing that is available. And we always appreciate the partnership with the school, who are sharing all the everyday actions that students and staff can take place by having good respiratory etiquette, washing their hands, and wearing masks as applicable, as well as the most important one, which is staying home if sick to reduce the spread of respiratory viruses. I also linked the Pima County Health Department vaccination link on the slide. And I think that's the last slide for me. If you want to go to the next one, Christopher. Resources are also here on the slide deck that will be sent out. I see a couple of people that have hand up. Michael was trying to get them to ask their question in the chat, but is there any questions that I can help address at this time?
Are you all able to see the slide now? Okay. Okay. I do apologize for the technical difficulties. Thank you so much for your patience as we work.
Thank you, Christopher.
Okay.
I think
Thank
that's
you.
into the next person.
Okay, thank you so much. So next, we have Ginny, who is our friend over at the Arizona Department of Health Services. She has graciously volunteered her time to come and talk to us over here at Pima County about testing drinking water for lead.
Okay, thank you. Good afternoon, everyone. Just want to make sure, can you hear me, Christopher?
Yes, I can hear you.
Okay, perfect. So good afternoon. Thank you so much, Christopher, for inviting me to be part of this call and to share this important information with schools and any facility in the Pima County area. You might have heard about this program before. I actually talked about the program, I think it was in the spring of 2022, so about a year and a half ago. So you might already be a little familiar about the program, but we have some really exciting updates that I'm really excited to share with you all. Oh, next slide. Okay, so ADHS is currently offering schools and childcare facilities the opportunity to have their drinking water tested for lead. And the number one question I get is, why should I have my water tested? First of all, I do want to preface by stating that it is an optional program. There are currently no federal or state regulations that require schools to test their water. However, we think it is a benefit both for the school and for the community. And there's several reasons why we think you should participate. But I just want to let facilities or anyone that works in the school know that it's not required, it is optional. However, we do know that, you know, if you're a school or a childcare facility, you're serving a vulnerable population. We know that lead is extremely toxic and highly poisonous. And we also know that children, especially younger children, are more susceptible to the effects of lead. The good news is that as we get older, we're less likely to absorb it. Young children, because their bodies are still developing, tend to absorb higher amounts of lead when exposed. We know it affects the brain and the nervous system. Even at low levels, it has been linked to underperformance in school and lower IQ. Schools and childcare facilities tend to have intermittent water use patterns, and this is because of the breaks. We know there's like summer break, winter break. So again, due to those breaks, there's periods of time in the year where that water is going to be sitting in the plumbing for an extended amount of time and it's not being flushed. Also, there is the potential for older plumbing. I have seen some statistics, some national statistics saying that there's some states that were up to 70% of the schools were built before the 1980s. That's probably less likely for Arizona because we do know that in Arizona, across the board, not just schools, we have a lot of newer infrastructure. However, that doesn't mean that there aren't older buildings or schools or childcare facilities that could have that older plumbing that we might be worried about, especially if there's a lead service line. That's something we want to look for. However, even if your school is a newly built school we still think you should get your water tested, because there have been instances where, although there is no lead plumbing, we have found that maybe there was a lead component in the drinking water fixture. So we have ran into those situations, and for that reason, we still recommend that your facility test its water, even if your school was built in the 90s, or even recently. We still think, just for peace of mind, you should still have your water tested, because for there to be lead in the water, it doesn't necessarily mean that there has to be a lead service line or there has to be plumbing with lead. It could be within the actual fixture itself. And the most exciting thing I want to mention, and this is probably the biggest update that we have regarding the program since we initiated this program, is that there is funding available for remediation. When we first started the program, we weren't allowed to use our grant funding for remediation, which unfortunately meant that if there was an issue, the school would be responsible for fixing the problem. And we know it can cost a lot of money to replace a drinking water fountain. But the good news is that we did receive additional funding from EPA, and we're now able to allocate those dollars for remediation. So if there is an issue, we will work with your facility to fix that problem and hopefully offset some of the financial burden. Next slide. So I wanted to give a really quick overview of the program and what it entails. A lot of the schools will ask me, should I expect? What does it involve? So first, if your school is interested in participating, we ask that you fill out a short survey, and you can go to our website. We have a link to that survey on our website. It's a very short survey, just basic information about your school, the name of your school, where you're located, how many students are enrolled in your school. So very basic information, just for us to learn about the facility. And once you fill out that survey, then we're going to get you involved in the next steps for making sure you get your water tested. So that next step, once you fill out that survey, is to complete a tap or fixture inventory. So we're going to ask you to take inventory of all the drinking water fixtures in your school, and we're going to help you through this process. We've built the inventory is actually meant to be filled out online, but we do have a paper version, because for the larger schools, we know it's easier to kind of do a walkthrough and actually take note of all those fixtures. So we're going to help you through that. We have several resources. And once you've completed that fixture inventory, then we're going to work on creating a sampling kit. And we're going to send you a sampling kit. All the water bottles are going to be pre-labeled. So again, that's why we ask for facilities to collect that fixture inventory, because we're going to use that information to create that sampling kit, which we would then mail to you, and it's going to have very specific instructions on how to collect those samples. We're actually also working on a video right now for those facilities that prefer to have a visual aid. So there's going to be a video on how to collect those samples. But in the meantime, while that gets developed, we are available for support, and we can hop on a call and walk you through it, or if something's really confusing, we're available to provide as much support as needed. And once you get that sampling kit, you're going to collect your samples. It's just one water bottle per fixture. So if you have 20 fixtures in your facility, you're going to collect 20 water bottles. We're going to include a prepaid mail label within that kit, so that you can mail your samples back to our state laboratory. All the analysis is being done at the state laboratory here at the Arizona Department of Health Services. And again, I want to emphasize that this is completely free. There is absolutely no cost to schools. So again, we're going to include a prepaid label. We're actually partnering with FedEx for this. So you can call FedEx and they'll go to your school. You don't have to drive or go to a FedEx facility to drop off the samples. They will come to the school to pick up the samples. And once you've sent samples back to us, all you have to do is wait for the results. Right now, it's taking the lab about a month to produce those results. It could be a little quicker depending on how busy they are. But we let schools know that it can take about a month to get those results. And once those results are ready, we will then send those to you via email, and we will talk about what the results mean. What we hope for is a best case scenario where there is no detectable lead in any of the drinking water fixtures. And there's really not much to do if that's the case, except, we do urge schools to communicate results for transparency with the community. And we do have parent template letters that we created for you to use. But if there is lead in the water above what we call the action limit, then we would work with you to, find out what's the best solution. Should we purchase a filter for that drinking water fountain? Does it need to be replaced? So we can work with you to find the best solution. And again, we're happy to report that we can actually use our funding for that right now. Next slide. So who can participate? So this program is open to Head Start programs, public and private licensed childcare programs, family childcare homes, charter schools, and I'm so sorry, I just realized I forgot to list public schools. So for those of you that might be familiar with the program or have heard of the program, we actually, when we first started this program, initially we were only offering these services to charter schools, and that's because charter schools never had the opportunity to have their water tested before. However, with additional funding that we received, we've actually went ahead and opened it up to any facility. So now public schools can also have their water tested. And again, I'm sorry, I just realized I forgot to list public schools, but yeah, so we've that has been a change for those of you that might have heard of the program before. It was only charter. Now any public school, any childcare facility in the state can have their water tested. And just so you know, public schools and childcare facilities did have their water tested in 2017. And that program was actually ran out of the Department of Environmental Quality. So a lot of schools are surprised when I tell them that. So if you're curious and you want to know what those results were, I know, it's been a long time since 2017. A lot of staffing has occurred. Maybe the person who did it at your school no longer works there. So if you're just curious, what were my results, I can help dig those for you, and then you can see, what the outcome of those results were. Again, that was for public schools and for childcare facilities in 2017. Next slide. So I just wanted to give a little insight into some of the data we've collected so far. So up until today, we've had over 240 public charter schools participate in the program. And again, that's because when we first got funding for this program, initially we were only offering the service to charter schools. However, we recently, just in September, so very recently, have decided to open it up to any facility in the state, either a public school or a childcare facility. So that's why you don't see a lot of data for public schools or childcare, because again, we recently, very recently, just opened it up to everyone else. But we have had about 45 Head Start facilities participate. And I do know this week we received a few applications for a few private childcare facilities, and I think a public school. So we're going to get more data for the public school and childcare facility. It's just that, again, we recently just opened it up to everyone else. Among the schools that have had their water tested, there have been about 11 facilities that have had exceedances. So basically, the federal action limit for lead in water is 15 parts per billion. That's what we're looking for. So if any facility has a result either at 15 or higher, we are going to require you to take some kind of step or remediation. This is the federal action limit that water systems are required to follow. So again, for a school, if you have anything above 15, we're going to ask you to implement some kind of action to remediate that. And again, we're very happy to say that out of, over 250 facilities that we've tested, only 11 have had either one or two fixtures above that level. And so far, they've all taken measures to they've taken action to remediate that. So we're happy to report that. And we do have results posted on our website. So you can go to our website if you want to, if you're curious about any facility, you know, in your area, or if you think you know that your school participated and you just want to make sure the results are posted, I would recommend that you go to our website. Next slide. Okay, so we do have a QR code that you can scan and it takes you to our website, and that's where all the information is. We have FAQs, we have the link to the survey if you know your facility is ready to enroll, and I'm happy to answer any questions at this time. And that is my, also I want to say that is my email and my direct phone number. So if you want to give me a call, go ahead, give me a call. That email is actually an email for me and my team who are working on the project. So you'll, you know, this way you'll know that you'll hear back from one of us. So yeah, so feel free to contact us if you have any more questions. I'm happy to answer them at this time.
Okay, I don't see any questions in the chat. However, we'll also give some time at the end too, in case anyone does come up with any questions. But thank you so much for this and this amazing presentation and amazing program. We're going to go ahead and move forward with Richard Sosa, who is part of our public health emergency preparedness, or FEP as we like to call it. Richard, are you on?
I'm here.
Awesome. The floor is
good
yours.
afternoon, everybody. Yeah, like you said, Richard Sosa, I'm logistics manager for our FEP team. It is growing a little bit. I'll just mention real quick that there's a new acronym, which is always fun, right? It's EMAP. It's Emergency Mitigation and Preparedness. And FEP falls under that, along with some climate environmental program and our shelter operations program, just so you guys are aware. Next slide, please. All right, so I basically wanted to jump on to let you guys know that I still have these following items here. So I have quite a few pallets of Lysol disinfectant wipes available. They do come in multiples of 6. I have given some to a few schools that just happened to reach out, but these are readily available for you guys to request. And along with that, we have some Spirit 2 disinfectant spray. I'm not sure if that's something that's allowed in the school, or I know it can't. If I remember correctly, Spirit 2 cannot be used on any surface where food will touch. But if you need it for maybe the nurse's office or something like that, it might be more appropriate. After this slide too, there is a picture so you guys can see exactly what I'm talking about. Well, I also have tons of hand sanitizer. They're small pocket size and they come in cases of 144. I'm happy to accommodate, honestly, as much as I can, quantity wise, for the hand sanitizer. And then also I have goggles that could potentially be used for science class, chemistry, things like that. Maybe even shop if there's any high schools on. So the best way to get a hold of us is to email fep@pima.gov, and that'll ensure that somebody from our preparedness team will at least see it and either forward it to me or my logistics specialist, so we can get to handling requests as soon as possible. That is going to be the primary way to quote unquote order. I know before some schools were ordering via our Survey 123 survey, but we pretty much went a couple of months without any requests, so that survey was closed. But this will be the best way to get a hold of us to request any of the items that I've talked about. They showed it earlier, but here again is the actual link for the COVID-19 test kits. Those are still available as well. We have self-test kits and a few of the AG card professional Binex now, meaning that the nurse or someone else has to administer that for the kids. We don't have a ton of those, but we may be able to accommodate a few orders for those as well. We do anticipate acquiring more from either the state or from our partner who was offering free tests, but they happen to kind of run out of those specific type of tests at this time. But we do anticipate having at least a little bit for you guys to utilize. And then next slide, please. And so these are the pictures of what else, the items that I just discussed. Feel free to reach out to me at the FEP email if you have any questions regarding these items, or if you want to inquire more on, scheduling pickup, or maybe we can deliver on certain case by case basis. It is tough though, because we don't have a truck with a lift gate that can get things down. So if your school can utilize a forklift, or can use maybe the district's main warehouse or something like that, where they can pull stuff off a truck, that would be the best if we're going to deliver. Otherwise, we do request that you please pick up if that's possible. Do I have any questions off the bat? All right. If there's no specific questions for me at the time, again, reach out to fep@pima.gov. That's PHEP at pima.gov. If you want to inquire about the items I discussed, or just if you have any other general questions regarding ordering any type of resources. Thank you for your time, guys.
Thank you so much, Richard. Really do appreciate it.
Yep, thank you.
At this time, does anyone have any questions in general that maybe I can answer, or anybody like Richard or Jenny can answer that you may have thought about? Okay. Seeing none, here's our contact information. Our next meeting will be in December, December 6th at 1 p.m. And I also just want to note too that our January meeting will not take place the first Wednesday of January due to winter break. So we will have our January meeting be on January 10th. Just a heads up. And we will be on for another however long, in case anyone has any questions. But if not, I hope all of you have a wonderful day, and thank you so much for attending today.